Madami ka kasi na itulog na.
Sandali lang. Now, effective communication also, which is timely, must be accurate, complete, and ambiguous and understood by the recipient. Because if they will able to understand, it reduces an error and also result from improving for the patient safety. So also for the reporting for critical test result, it must be handed with your colleague. It must be endorsed and it must be a label also. Verbal and telephone orders should be included in documentation. Dapat nakasulat yan, in you have to write down, and it must be readable. And understand the communication method includes by asking and answering question during the hands-off. So you have to, there must be a question and answer for that effective communication. In appropriate abbreviation, also symbols and wordings. Like for example, if we do the charting and you do the wrong abbreviation, it is also not considered. It is a error because it is not written there correctly. Like for example, there is it's like TID, isn't it? The TID is 3 times a day, and there it was written BID. So it's twice a day. It depends. It must be readable, the abbreviation, and it must be right. Or sometimes we are doing a shortcut. In medical terms, we are not using a shortcut or our own style for like for shortcut written, like for the at or with, like that. We are not and we are not doing that one. We are writing the whole, we must write the whole letters or our main objective, or kung ano yung gusto mong iparating, isulat mo clearly. Now, during this one, you have to be considered the situation also, the background, the assessment, and recommendation. Like for example, you went for the patient rooms and you have seen something which is, you observe something different from the patient. You look at the background and you see that there is a chair or there is a table that may cause harm for the patient. So you have to take the notes for that. And then you have to assess that one, and you do recommendation that this thing should be removed like that, so that because the patient may cause them harm, or when the patient may fall, it may cause trauma for the patient, like that. And handover for the patient care with hospital situation is that between the healthcare providers, such as between the physician and the other physician or healthcare providers, or from the one provider to another provider during the shift, it must be handed over correctly. And in between different levels of care in the same hospital, such as when the patient is moved from intensive care unit to medical unit, or from the emergency department to the operating theater, there should be a full written order or safety for the patient, that hindi siya pinag-uusapan or anything else. Confidentiality of, especially when the patient there is a note that this must be confidential like that. Or from inpatient units, diagnostic or treatment departments such as radiology or physical therapy. You must be put down in handovers for the patient care, especially in hospital area. Now, to improve safety and for the high alert medication, like for example, in hospital develop implements process to improve safety of high alert medication. It should be manage this one by the, like for example, sa mga nurses na, sa mga but if in case they delegate to you or they ask help from you, you should know, as we have studied also in medication management, that by delegating, you should know what kind of medicine that they are delegating to you, and you should know what is the action. If it's you know that is right for you to do not accept any obligation. You have to let you have to tell them that I cannot do this one. If you want to do this, give this medication, you give to the nurses, because it's not really your function to do that one. So in order for us also, we have to take care, not also being yung masipag ka, industrious like that, but we have to consider yung condition that we have to take care of our name, our license like that. So we should be very careful for the things, especially when they delegate you this one to. Some nurses are doing that one because of too much patient, but you have to check for that one before doing such a thing, like this delegating medicine. Now, to improve safety for medication alert, I think we discussed it already also. This to ensure the correct site or correct procedure for correct patient surgery, ineffective or inadequate communication between members of the team. So there must be effective communication between the team. Like for example, when the nurses tell you to bring this one to the surgical area, bring this patient, and for you have to check if it's that is the right patient. If this is the you have to check for the thing that you have to bring, like for the file of the patient like that. So you have to be very careful to check for that one, if there's any contractures and maybe you hit that one, or any IV fluids or anything that is put on the patient. So we have to be very careful that one also. And lack of patient involvement, like a site of marking or lack of procedure verifying the operation site. I think this one is for the nurses already. The thing is that for the proper correct patient surgery or like that, the thing is very careful for, like for nursing aid, is the checking the right patient with you. And the things that yung mga contractures na nasa kanila, yun ang importante. And there are also some surgical safety checklist. Number one for you, especially pag na-assign kayo na dalhin nyo ito, yung patient, ganon, you have to be very careful to check for the patient. If the patient is confirmed, you check the identity, and you have to check what kind of procedure that he will take, and which area he has to go, like that. So be careful for the delegation, because usually delegation is, there are so many things for an error also. It's not anymore for this one. Now, as a healthcare, we have to reduce the risk of infection. So we have to always to wash our hand for infection prevention and control. We have to do hand washing always to eliminate this, like for nosocomial infection, also like that, hand hygiene. So we have to wash our hands. Now this one reduced to the risk of patient harm resulting from fall. Now fall account is a significant portion in injuries of patients. It is very important for us that to take care of our patient. We have to always put the side rails, and we have to evaluate the risk fall of the patient. Like for example, yung mga nakalagay sa kanila, like for the contractures, there are some IV fluid stand, or there are some other BT blood transfusion stand, and different thing that is near to him. So we have to put little thing aside, away, little bit away from them, so that in case there are some patient who are already confused and naughty, they may hit about that one. And we have to evaluate the action that reduce the risk falling to reduce the risk of injury. Injury should fall occur. The evaluation could include the fall of history, the medication, alcohol consumption, the gait, balance, screening, walking. It's not already that one for us. Now, in preventing patient fall, training the patient also is very important, and the patient family. You have to instruct the one who is with them, like the families. If the patient is they want to go out of bed, or they want to walk like that, not leaving the bed with any help. Do not leave the patient with any help. Always be with someone with them. You have to use a object that replace near to the patient. There must be like a bedside table with them, which is very near, because if they want something and then they want to reach that one and it's very far, the patient really they try themselves to pull or to take that one. So dapat malapit lang yung bedside, so that they could take the things with them easily. Now, the bed height is fixed at the lowest level, so that when the patient may fall, hindi mataas ang pinakahulugan niya. At the same time, all siders must be in up position. Instruct the patient to wear non-skid footwear. So, use also unused equipment to remove from the room. Proper lighting. Pagpatayin din ng ilaw. Yung room ng pasyente dapat sa well ventilated, and there is a light, because patient is sick, and we have to feel them maganda yung nila room nila, and it's well ventilated, and imbes na gagaling yung patient mo, hindi gagaling pag hindi madilim, at saka it must be attractive and good. Maganda yung ambience niya. So this will help the patient for yung madaling paggaling. Now, I have here the how to perform a bed bath for the patient. We usually do this one for the TPD sponge bath for the patient. But I think this one we tackle it already in grooming and hygiene. But there are something that we have to do. We have to do by actual. So, inano ko lang ito, kinapi ko lang siya. But we will do this one later on. We will schedule para maduing actual. Well, definition is performing a bed bath. Bed bath is to a patient who is in bed, who cannot, unable to take a bath by themselves. The purpose this one is to prevent bacteria spread of the skin, is to clean the clean body of the patient, to stimulate circulation, to improve general muscular and tone joints, to make client comfort, and help to induce sleep, and to observe skin condition and objective symptoms. Now, usually the equipment that we have is that we have the basin for without soap, and with soap. We have the bucket for clean hot water, and also one for waste. We have one jug, soap with dish, sponge, with soap and for rinse, face towel, bath towel for covering the Macintosh, covering the client's body. We have a gauze, Macintosh, trolley, thermometer, old newspaper, paper bag, or to clean the waste. Now, in doing the sponge bath, we have to do it with the patient na yung pupunasan natin, it will start from the yung kung paano yung proper one. But right now, hindi ko kasi ano kasi there are so many things that we have to tackle, and I want to compress this one in 2 meetings. And then we will go to the module 3. I will send you all the copies kasi gusto ko, meron kasing logo. The one as you remember that before, I'm sending you some slides without logo for skills. Now, I need to put the logo of skills. So, I may ask you kung pwede, bigyan nyo ako ng a day to do this one. Yung ayusin ko, edit ko lang yung mga slides ko, and then I will give it back to you. Another thing is that yung dressing procedure. This is to ensure. Hello? Do you have any question? Bago pala ako mag-start. May question po, may tanong? Esther, you have any question? Jing? Sus, any question? Gracia?
Wala po, ma'am. Let's move on sa wondrous things.
Oo. Maybe you are wondering na we have so many topics for today because we this new module that we have right now, we have to comply up to it because next level ninyo parang mas madali na ninyong magawa, tsaka repetition only, and mostly on your next level already you have the demonstration already. That's why we will tackle one by one. I will study also for this one para maibigay ko yung full data and information sa inyo. So we
ma'am,
go on
ipo-forward mo naman mamaya, ma'am, yung ma'am, no?
Ibibigay ko sa inyo yung bago nating module na pag-aaralan, saka ko sa inyo. Pero yung give me until tomorrow or the next day for the slides because we have so many things i-edit pa at the same time maraming topics yung i-forward ko sa inyo. Like for example, today we discussed the vital signs.
Hindi siya clear, ma'am.
Hindi nga siya clear.
Ang voice.
No.
Email mo na lang sa akin, ma'am.
Okay. I will email na lang with your president, si Esther, and then i-share na lang niya sa inyo. I-edit lang kasi medyo mahaba siya. Like for example, our topic for today is the vital signs, and then the patient safety goals, and then also the tipid sponge bath, and then the application of wound dressing. Ayan, medyo mahaba siya, pero sabi ko, yung iba kasi, yung supposed to be from level 2, natapos na natin, pero kinompress ko siya in 2 meetings, and then after the 2 meetings, we will go on for the level 3. The level 3, some of this na-discuss na rin natin, so may nabawas na rin. Gusto ko kasi matapos natin yung from the level 2 hanggang level 3, complete yung yung na-tackle natin lahat ng topics. Kasi yung bago, hindi natin tackle lahat, so dinadagdagan ko siya. I will send you also our modules later on.
Sige po, ma'am. Salamat.
Okay. And then we have now the objective for the wound dressing is to ensure the nurses, or not also the nurses, sometimes we are, the nursing aid is with us to perform the wound dressing using aseptic technique. This one we are assessing to care for the component of dressing. Nurses perform the wound dressing using aseptic technique, but usually this one we have assistant. We have one, you are with us, like for example for assisting, giving all the things that we are needed. Like for example, when giving this dressings, kasi maraming mga gamit. Sometimes we also endorse to you, or if you are working in the at home also, you are the one who do the dressing. So at least you may know. And doing the dressing, nurses should be documented what are the findings in sa pag-dressing nila sa patient natin. Now, the purpose is that we have to provide the thermal installation, observe drainage, and debride the wounds, or both. We have to prevent hemorrhage also when apply that pressure dressing with the elastic bandage. The purpose is that the speed and immobilize the wound side, therapy by facilitating the healing and prevent injury. So, nilalagyan natin ng spin to immobilize the wound side para ma-promote ang healing at saka ma-prevent ang another injury for the patient. There are different types for addressing. We use for the minor wounds is the gauze. Ito yung gauze na nilalagay natin sa patient natin for a minor wound that we have. We have also put the tool, like for example, supra tool, ganon. These are the tool is a medication na naka-attach na para siyang dressing din, may gauze siya. It doesn't stick to the wound surface. It is usually used for the patient who have a sensitive skin. Usually we use this tool for the patient, like sa mga burn patient, because when you want to dress again for this wound, it is very easy to remove kasi meron siyang gamot na kasama. Actually, this is the gauze and the medication that is put in the gauze. Ito siya, yung mga different type of tool. And we have also the semi-permeable. This composed the sterile sheet. It is transparent, which can allow to check on the wound regularly, suitable for the shallow wound. Kadalasan, ito yung plastic one. If you remove that one, you could easily see, transparent siya. As you can see, it's transparent. But like a bandage siya. Pero you could easily see the wound. We have also the hydrocolloids. It is available in many forms. That is, it is used for a larger wound. Ito siya. Ginagamit siya sa mga malalaking wound sa mga pasyente natin. It varies different size also. It also have a hydrogel, which is composed mainly water and composite network. Ito siya. This is the types of hydrogel that we are giving to the patient in wound care. And also we have this hydrofiber, non-soft woven pad that interacts with wound drainage. This one, it provides moisture for the environment in deep wounds that needs to be sealed, yet air can be penetrated. Kahit nilagay mo to, there's already air. This is the one. There's still air for that one. Now there's the procedure and dressing a patient. First, when you go to the patient and you want to dress the wound of the patient, you go there, you have to greet them and acknowledge the patient. You have to introduce yourself and you have to explain what you are going to do with the patient, explain and assess the pain of the patient. And in doing, changing the dressing, you have to also ask the patient if it's still painful. And then, You have to prepare the trolley for dressing. All the things that you will need, you have to prepare it already at your bedside. Trolley for dressing. And then provide privacy for the patient. Before you change the wound of the patient, you have to provide the privacy. You have to pull the curtain of the patient and use aseptic wound dressing. Hindi yung you go to the patient and then you have to change already immediately for his wound. Nakakaya maybe sometimes there are some hospital that there is a sharing, and it's also you have to provide their privacy. Mahihiya ang pasyente, and then they will not cooperate with you if you will not introduce yourself and if you will not provide them privacy. They will tell that I will do it later on. But if you pull the curtain or like that, and you could easily do. And then also you have to place the patient in comfortable position. In placing the patient in comfortable position, you could easily do it immediately, because if the patient is you did not position in comfortable way, the patient keep on moving like that, or the patient is complaining. So it's better to position first, because this is one factor also that delaying of doing the dressing. And also, before touching the patient, you have to perform hand hygiene. You have to wash your hands, because if you will not wash your hands, maybe you went to the patient with communicable disease, and then you went with this patient, you having a wound, wound, and it will contact communication, contact transmission. So the patient will acquire also the disease. Instead na galing yung patient will have also another factor, another disease also. So the infection, you transfer the infection to the patient. Now, when doing the dressing, you have to open the dressing set, which is the outer part. Now you have to discard all the soil dressing. Once you dress the patient, itapon mo na immediately itapon mo na yung mga soil dressing. And then when you have dressed the patient, you have to perform the hygiene again, because you will touch another patient again, or anything that is not infected, or not do not touch anything. Now, another thing is that to open the inner layer of dressing, you have to add the necessary items, such as non-touch technique. So when you open that one, it's immediately directly to the dressing area. Do not touch by bare hand when you open the dressing. Performing hand hygiene, you have to wear sterile gloves. This is optional, but usually we usually do this one, and prepare also for swab, especially when they require for a testing, laboratory test. Now, you have to maintain always, in performing dressing, you always maintain a sterile field, sterile area. You have to correct aseptic technique while performing the dressing. It should not be contaminated from the unsterile area. It must be always a sterile area. You have to apply in a secure one and appropriate for the wound dressing. Talagang ganito siya. Yung different types ng paglagay ng wound. And every time you have to do dressing, you have to perform hand hygiene. This is an example for ito yung bed sore na sinasabi, which is in the lumbar area of the patient. This is usually kino-cover natin. And additional for that one also, when we do care for wound care, mini-measure din natin kung hanggang saan na, gaano kahaba yung how many inches now the wound. If it's progressing become big, or we have to note if it's progressing na lumalaki siya or not. Now, any question?
Wala na po, ma'am.
Oo, natapos na natin. Pero kaya inano ko agad kasi i-prepare ko yung ibibigay ko sa inyo yung these slides for you to study. Now, I want you, all of you have already a blood pressure. Because number one, when you are having this practicum, or kung magtatrabaho kayo as a nursing aide, number one that you have to do is this vital sign. So you have to study by heart yung vital sign natin. So mag-practice na lang kayo dyan sa bahay muna ninyo. When you check for that one, like for example, yung respiration, you have to check your patient, yung pag-rise and fall ng ano niya. And then at the same time, also yung pulse rate niya. You use this one, ito, and if the way when you feel there is a palpable, yung nagpapalpable siya na gano'n. Or if you cannot, you go here or to the other parts. Femoral, dito sa may singit, or to the sa popliteal, or from the other parts sa baba, sa paa. You try for that one. And is it okay that during our last meeting, pwede tayong mag-meet for the demo?
Pwede po, ma'am.
Pwede for demo.
Para at least ma-perform natin.
O ma-perform ninyo. Kasi by next level, paulitin na naman ninyo, pero hindi na yung mabilisan na yan. Because as I heard, like from my other class in caregiver, may mga nakukuha na nilang nag-work. So at any time also, if they need someone na pwede kayong mag-ask kay Ma'am Maricar na pwede kayong tulungan din na to look for a job for you. So at least you have any skills, you know how to take the vital signs already, you know how to do the bed making, you know how to change the wound, or some other techniques, how to do grooming, how to do hygiene, and dapat maano natin yun.
Ma'am Glo,
Oo.
yung pala, ma'am, di ba for example sa surgery, yan, normal lang po ba yan na nangingilo siya? May times sa na pag malamig,
Actually, once na na-operate, oo, normal lang siya.
Normal lang
Nag-ano
siya.
siya sa loob ng katawan mo, kunwari, nagpapalpitate pa siya. Especially when yung newly operated, when you are newly operated, it's really, nag-ano pa siya, nagpapalpitate siya sa loob mo. But, ang lang, when newly operated ka, kung ganwari, you have to wear, kunwari, you have to cover yourself first kasi mas maganda yung yung hindi ka na-expose yung parts of your body. At the same time kasi mahirap yung pasukan ng lamig. So
okay. For example, ma'am, pag sa bahay lang naman siya, kailangan po i-cover talaga yung yung wound. Like yung tahi.
Ay, tahi.
Oo, pag tahi siya.
Anong klase ng tahi? Sa surgery pa rin?
Oo, sa surgery pa din po.
Sa surgery. Ilang araw
Kahit
na?
i-open mo lang, wala naman yan. Wala naman problema yun.
Ilang araw na siya?
Na siya, 4 days.
4
4
days.
to 5 days.
Kadalasan kasi if newly operating yung patient, it is better to be yung covered ba siya para maiwas yung natin yung exposure sa infection. But pagdating na ng ilang araw, pwede mo na siyang i-open. Maganda kasi pag na-open din siya, nagda-dry up siya. Pero before mo na i-open, dapat lagyan mo na siya ng mga katulad ng linisan mo na siya with betadine, and you put some ointment like that, the medication. After that, you could expose kasi air will help also to dry up the wound. So, mas maganda din yung katulad ng sa mga bata, pag may mga wounds sila dito, yung sa mga sinasabi ko sa kanila na expose mo lang siya, pahanginin mo lang siya, it is very easy to dry up.
Mm-hmm.
Ayun po. Tanong pa po.
Any question?
Any question? Lynn, may tanong ka? You have any question? How about Sus?
No question.
Okay. If you have any question, you can send me message at any time, no problem. And then,
Ma'am, ilang sessions pa po tayo?
Actually, 6 sessions tayo. But then,
Pang-third natin ngayon?
Pang-third na
Kasama
natin
last week, ma'am.
Oo. Pang-third na natin ngayon. Pero ang gagawin ko, siguro baka 7 tayo kasi may in-insert akong topic sa inyo na ang pangalan nito, additional para ma-cover up natin yung bago nating module. Because they are checking for the modules and it's very important to have this module na ma-complete natin lahat ng mga requirements being as a nursing aid. Because ibig sabihin, if we cover like the vital sign, bed making, patient safety, patient goals, management of medication, hygiene and grooming, like that, everything, and then when we are done, we could able to handle the patient already.